there, I'm Misty. So today in the classroom, we are going to be performing one of the skills required at state. We're going to be taking and recording a manual blood pressure. In your book, this is method number 3. It's the one that's required at state. So we're going to get started. Knock, knock, knock. Hey Terry, I'm Misty. I'm your nurse today. I'm going to be getting a manual blood pressure on you. So we're going to go ahead and pull your privacy curtain here. Make sure your curtain is pulled. You're going to get your blood pressure cuff. Be sure you have your stethoscope. I already have mine here around my neck. You're going to clean the earpieces. Both sides. And in real life, you should probably use a different alcohol wipe to clean the diaphragm. But at state, it is sufficient to just use one. Throw your little pieces away. I would clean your hands again because you just touched something dirty. It's not required at state, but you just touched something dirty, so you don't want to touch your patient after that. I like to be sure that my bed is raised for this because a blood pressure is pretty important. We want to be sure it's accurate. You want to be sure that you don't struggle as you're trying to get a blood pressure. And you want to be sure you can position your patient appropriately and your tools appropriately so you don't have any issues. So I would go ahead and raise the bed to a comfortable height. You're probably going to get a patient that's either sitting or in bed. You need to be sure that the arm is at heart level. Currently, my patient's arm is at what we would call heart level. If they're sitting in a chair, you'll want to place that arm on a bedside table, an overbed table, where the arm is at heart level so you can work with it. You want to be sure it's accurate. It does need to be at heart level. It's required for the skill at state. So, you're going to expose the arm. So if they're in a hospital gown or a sweater or a jacket, whatever it is, if you have to remove the jacket, you need to do that. You want to be sure that a hospital gown is moved up. You need to expose the whole bicep or as much of the bicep as you can because this blood pressure cuff is supposed to cover about 2/3 of the arm. You need to be sure that the brachial artery is going to be palpable and that you're able to place the diaphragm of your stethoscope over where you need to listen to your heartbeat or your blood pressure. So I've already exposed the arm here and I'm going to place the blood pressure cuff. With practice, you should just automatically know that the soft side goes on the inside against your patient and the scratchy side is going to go on the outside. Most blood pressure cuffs are marked. It tells you where the artery mark is. So this part of the blood pressure cuff where the arrow is should be going over your brachial artery. So you might want to go ahead and get into the habit of holding your tubes in place, placing your fingers where the artery mark is so it's easy for you to place on your patient. You should also know where to locate the brachial artery on your patient. So what you're going to look for is the antecubital fossa, which is the middle part where most people get lab draws. So right here, and then you're also going to look for the elbow on the medial side towards the body. So in between the antecubital fossa right here and the elbow is where you're going to find the brachial artery because it comes off of the aortic branch over here, goes right in between these two muscles, the bicep and the tricep back here, and it kind of just feeds on down in between the antecubital fossa and the elbow right there. So you should be able to find the brachial artery right there. You need to be using the top thirds of your fingers, the first 2 fingers, to look for that brachial artery before you place your stethoscope or your cuff. It's not wrong for you to place your cuff and then find it. It's easier to find it without the cuff in place. You don't want state to see you looking all over the place for your blood pressure or your pulse. You should be practicing so you know where to find that brachial pulse. So you're going to find your brachial pulse, and then you know where to place your blood pressure cuff. So you already have it in your hand. You're going to place your cuff. Cuff should be nice and snug on the arm. Be sure it's placed appropriately. You are going to have a human at state. You probably will have a nurse examiner that's got a teaching stethoscope. Somebody's going to be listening on the other side to see what your values are compared to what you actually get and record. Right now we're just going to do it with the one stethoscope, but please be aware that somebody will be either right next to you listening or across the way on the other side of the patient listening with a teaching stethoscope. So you're going to place your stethoscope, earpieces in your ears. You need to check To be sure it's on the right side, if you don't hear anything or you're unsure, please flip the bell of your stethoscope so you can check to be sure it's on the right side. So I know that this is on the right side. So you can either let your stethoscope kind of sit here while you're working, while you're pumping up your cuff, or you can go ahead and place it. Either way, you want to be sure that it's not rubbing, that it's not altering any of the sounds that you're going to hear. So I like to move my tubes out of the way. I like to move my gauge over here and have my valve in my hand, or my pump in my hand. You're going to check your little dial here. Be sure that it's all the way tightened up, lefty-loosey, righty-tighty. So you're going to tighten it all the way to the right, but not too tight, because you need to be able to control it with one hand. You need to be able to release it to the left like you're going backwards in time with one hand, so that way you have your other hand to hold onto your stethoscope. So you're going to pump your gauge up here all the way up to 160/80. When you pump it up, it should be between 160/80. I've pumped it up a little too high here because we have Terry. But it should be somewhere between 160 to 180. That's what the state anticipates most blood pressures will be for you guys when you're testing at state. Then because you already have your stethoscope at the ready, you're going to place it over the brachial cuff, or brachial artery. You're going to hold it in place, and you're slowly going to release the valve very, very slowly. You're going to imagine a clock, and initially both hands are pointing up at 12 o'clock. You want to release it very slowly so that minute hand goes backwards in time, maybe 2 to 5 minutes at the most. Release it very slowly at first so you can listen, and then you're going to listen for your top number, the very first sound that you hear, and you're going to keep listening, and you're going to watch your gauge until it goes all the way down and you don't hear anything anymore. As soon as you don't hear anything anymore, go ahead and release the valve all the way so your patient can have their arm back. There's no more pressure on that arm. I would go ahead and take your stethoscope off so it's not banging around and hurting your ears. Take your cuff off. And then you're going to record your value on the recording form that they give you at state. So be sure you record it accurately. We're going to say that the blood pressure was 120/80. You're going to be sure that your name is on it. And you're going to sign. If you record it in the wrong place, it is going to be counted as wrong. Be sure that your nurse examiner has that recording form before you leave. If you raised the bed or if you repositioned your client for your set of vitals, you need to be sure that you lower the bed, put it back in place before you leave the room so your patient is safe. You guys can't see it, but all the students are standing behind my camera person and just watching. It's not creepy at all. All right, Terry, here's your call bell. I will be back to check on you in about an hour. Just give me a call if you need it.